Welcome back. I'm here. I'm going to do a respiratory assessment on you today, which is a physical assessment instead of just asking you the questions. And you have a respiratory history, correct?
Yes.
What do you have going on?
Asthma.
Okay. How are you feeling today?
Feeling fine.
No shortness of breath?
No, I've been
Okay.
congested from allergies, but
Okay. Well, I just washed my hands and I'm wearing a mask because of COVID-19 and we're not going to be able to do the social distancing. So I don't want you, because you have this history, to get any kind of infection or anything to make it worse. So what I'm going to do is I'm going to start with just like assessing you, like observing your chest to see if it's symmetrical, if you're having any labored breathing. We'll look at your skin. I could see you have nail polish on, but we can look to see if like your nails are blue, which would mean like your oxygen level is low, or your lips could be blue. You have lipstick on too. Kind of makes it hard, but we could do that as well. We could also look for tracheal deviation, which would be your trachea could go to one side, and that would be like if you had a pneumothorax, which would be like if your lung collapsed, your trachea would shift to the unaffected side. That doesn't usually happen, but it can be spontaneous sometimes. But with asthma, it's usually not an issue. Do you have any questions so far?
I don't think so.
Okay. I'm going to listen to your lungs real quick. I'm going to do it in a Z form because you have 3 lobes on your right side and just 2 on your left. So I'm going to start in the back. And just deep breath in. And I'm going to listen to the front. Now normally your lungs should be clear, but on your right upper lobe, I can hear some wheezing, like expiratory wheezing when you're breathing out. Have you taken anything for that?
No, I just use my inhaler periodically.
Have you had to use that recently?
Yesterday, yeah.
Do you feel like maybe allergies
Probably. It's been happening a lot.
make it worse? The
Mm-hmm.
weather changing?
Yeah.
Also, animal dander,
Yep.
carpet, which, I mean, a lot of places have carpet. There's not a lot you can do about that. Maybe vacuum every day to keep the allergy level down. Really, that's about all you can do for that. Do you take anything else?
I take metoprolol, but that's just to lower my heart rate.
Okay, so this doesn't really pertain to that. All right. So I have a pulse ox, and what this does is measures the oxygen in your blood, and you're used to it because you carry one usually anyway, right?
Mm-hmm.
Okay. I'm just going to watch it for a couple seconds here to see how much of a change there is. So you're 99, 98, 99%, which is perfect. You like you between 93 to 100. Your heart rate is in the 90s, which is a little high, but not horrible. I know you said you're on metoprolol. That helps with you have sinus tachycardia. So if you were to take any kind of steroids, that could make your heart rate go up too.
Mm-hmm.
And while I was doing that, I was also looking at your chest to count your respirations because we don't like you to know that we're counting them because some people might breathe a little heavier. So you were like 16, which we want you to be between 12 to 20. So that was perfect. I would just continue to keep doing what you're doing. Just make sure your allergies, you're keeping it under control. Your pulse ox stays up. You can monitor that yourself. Another thing that we have, but I don't have it with me, and I don't know if you have one or not, it's called a peak flow meter. And it's a little inexpensive thing. Respiratory can give it to you, or your medical doctor. And basically you breathe in it, and it just tells you how much oxygen is going through your lungs when you breathe into it. Normally it's like 400 to 700. You could talk to your primary doctor about getting that. It's a good thing to have if you're asthmatic. Do you have any other questions or anything?
I don't think